In this chapter, we will continue looking at the male's sexual anatomy and physiology, but we will focus on the internal sex organs, and more specifically on spermatogenesis. To lay out the internal sex organs that are of interest to you and that you should focus on are the testicles, epididymis, which we introduced you to earlier, the vas deferens, seminal vesicles, prostate gland, and Cowper's glands. Maybe you could do a recap of things in here, and if I ask you which of these were to be involved in the ejaculatory process, you would know that all of these right here are involved, but one of them seems to not be involved at the time of ejaculation, more so before. Think about that. To elaborate on testicles, it's important for us to know that there are two egg-shaped glands in the scrotum. These are about 2 inches long and 1 inch diameter, and we understand that typically one of the testicles hangs lower than the other. This is believed to be the case so that there could be a reduction of any possible accidents by allowing the sliding of the testicles to go past each other rather than compress in case the legs were to squeeze them together. You maintain the testicles healthy and safe. The primary functions of the testicles are to produce testosterone and also spermatogenesis, which is the creation of sperm. Now it's noted by some individuals that have studied this more that left-handed men may have the right testicle hang lower than the left, whereas right-handed men may have the left testicle hanging lower than the right. While this may be the case in a small sample size, this has not been consistent across the board. When we look at the internal structure of the testicle, which is what you're looking at, it's important for you to know that the word testicle originates from the word testify, the Latin word for testicles. The practice of holding one's testicles while testifying in court of law was based on the belief that unborn generations would seek revenge if the truth wasn't told. This is why during the Greek and Roman times, eunuchs, which were those men who had their testicles removed, were not allowed to testify in court. So interestingly, for a while, this has been used as a form of even moral superiority or higher ground. Here you can see the shape of the testicles and how vascularized the testicle is. And there's a lot of blood vessels and nerves that are there, which is what makes the testicle such a sensitive part. And also the one that is likely pumping out and constantly producing sperm for a longer period of time than women typically. The climacteric period, which is when women go through menopause, reaches their age significantly younger than men. Most men that go through the equivalent of menopause, which would be called andropause, it happens around the 70s and the symptoms are not as accentuated. So a lot of blood vessels, a lot of nerves in here. When we look at the testicle here, you'll find that the testes, this right here, would be the outer layer, and inside you'd have the seminiferous tubules, which allow for the sperm that's created from the outside to mature and start making its way to the head of the epididymis. This is where it goes through and eventually starts finding a road from various tubules. It starts finding here, and then once it makes its way here, it starts winding down all the way through and then back out until it starts reaching a more straight road, and that's what we call the vas deferens. The vas deferens then starts going through, and you may remember then this makes its way all the way down through the seminal vesicle and eventually over through the prostate gland and then making its way over through the urethral opening. The approximate time of maturation of the sperm that we see in here is that while the development is occurring here at these tubules, the sperm maturation process typically takes about 72 days. Now, spermatogonium, which are immature sperm cells that eventually develop into a spermatocyte, the spermatocyte is what we call the intermediate stage, and there's a primary and secondary stage. We'll look at other pictures in future slides. And then that becomes a spermatid. And these are cells that make up the final intermediate stage. There's an early and late stage. This then reorganizes the nucleus to form the head. Then there's a midpiece, and then there's the flagellum, which is the tail. The head becomes covered with enzymes that would allow the sperm to penetrate the egg should it ever get there. And then after that, you reach the form of what we call haploids, which is what we call an immature sperm. Please note that each male produces about 300,000 sperm per day, and this is a byproduct of nutrition and cholesterol and other good cells that are there, not to mention the Y chromosome. Once again, the sperm maturation process takes approximately 72 days for each individual. Now, spermatogenesis is continually taking place with various levels of sperm development throughout the testes. And again, on the outer part of the testicle, you'll see how you start off with the most undeveloped part in here, spermatogonium, which is what we call a diploid. This actually has all 46 chromosomes that are there. But with time, they'll start developing into something that becomes an immature sperm. And this right here, rather than carrying 46 chromosomes, only carries 23. The reason why is because when there is a conception of an organism, the sperm brings in 23 chromosomes, and the egg from the mother brings in 23 chromosomes, giving a total of 46, which is what we see as the norm within humans. There's, of course, variations of that, and we'll talk a little bit more about that after, but this whole process from transitioning from here to here is about 72 days. Now, the ability of the sperm to swim, that's motility, and the volume begins to decrease from ages 22 until about 80 years of age. So we find that your most fertile years typically are in your late teens and early 20s. As soon as age 22, we begin to see a decline in the sperm's ability to travel and also the volume of that. It's also important to note that research has shown in 2006 that men who live in areas where pesticides are commonly used also have reduced semen quality. The use of soy products have also been contradictory in scientific findings. Some studies report that there could be a hormonal change in a man's body if there's a large consumption of soy products, as it does mimic estrogen in the body and can reduce the viability of sperm. We do find that 7% of infertility cases are due to defects in the quality, concentration, and or motility of the sperm. So when we look at this being the issue, we do not know of any treatments to improve this. We do recommend, however, that men keep radiation and heat as far away as possible from the crotch area, as heat and higher temperatures can be a detrimental factor. Once the immature sperm got here, and that's 72 days approximately, it begins to travel from the tubules to the epididymis. And you may remember the epididymis is to the top part of the testicle. There, the organ will hold the sperm during maturation, and the maturation process typically lasts 10 to 14 days in there. And that's where the immature sperm will become a spermatozoon. That's a mature sperm cell. Upon the maturity, then spermatozoa, which is plural for spermatozoon, are transferred to the vas deferens for storage, and at that point, it could be stored there for several months before it is ejaculated. Some old and faulty sperm are absorbed in the epididymis so that they will not be released. And if so, we look at the combined maturation process. If it does get released right after it reaches the vas deferens, of about 90 days. That is to say that whatever is ejaculated, perhaps in June, actually started developing 3 months, at least 3 months prior to that specific time. But again, at any given moment, we have sperm that is continuously developing at various levels of the sperm development. If you do not know the answer to the question I asked earlier about the ejaculatory pathway, Please note that the ejaculation, which is the physiological process where the seminal fluid is powerfully expelled from the penis, goes through these organs in here. However, of all of these organs that we see here, the Cowper's gland is not the one that's involved in the ejaculatory pathway. And the reason why is because this, as you may remember, sits in the back of this right here. If you have the Cowper's gland, or you have the release of the sperm, we start off here with the testicle, and then it travels through, and then it goes out to be ejaculated. However, the Cowper's gland would actually be a little bit of a detour over here. And this Cowper's gland right here would be responsible for cleaning the urethra that would have also been used by the bladder. This right here would be the bladder. That's what it says in there. And the Cowper's gland, again, the role is to clean the urethra from any urine that may have been left in there. And remember, it does carry some sperm, as what it releases is the pre-ejaculatory fluid. Last slide of this in here is how ejaculate works. About 2 to 5 milliliters of fluid are released per ejaculate. And within each, we have about 50 to 150 million sperm per milliliter. Anything less than that would actually be considered infertile. And there are very few sperm that actually reach the ovum. The majority of the sperm actually die upon entering the vaginal cavity. And the reason why they do is because, again, there is a very acid environment. What allows for them to get there is the protection that the semen and the prostate fluid that's released protects it. For example, the seminal vesicles, there is a nutritional bath so that the traveling sperm can actually withstand all the acidity in here. About 60 to 70% of the ejaculate volume takes place in here. When we look at Cowper's glands, the prostate gland, it's about 25 to 30% of the ejaculate volume. Almost everything that is visible to us would have been released by the prostate and the seminal vesicle. And this secretes substance that neutralizes the acidity of the vagina that would be lethal to the sperm. When we look at the semen that, again, is released in here, we find that a lot of the sperm would work together to try to fertilize the egg. And the ability of the sperm to fertilize the egg has a lot to do with how healthy the sperm is. Again, the younger you are, the more fertile you are, the more aggressive the sperm are, and the more protective enzymes that they have in the head to be able to penetrate the egg. One last thing is also that semen is coagulated upon ejaculating. So when an individual ejaculates, the semen would be a little bit thicker for a while. But if you just leave it there and let it sit in an open environment, it actually becomes a little bit more liquid. It liquefies and it runs a little bit easier. The coagulation takes place to help the sperm remain in the vagina and travel into the uterus. If it were to be liquid since the beginning, then it would leak out faster, reducing the chances of impregnating. This thins out about 5 to 20 minutes later, because if it didn't, again, it would inhibit the movement of the sperm to make it to the egg.